Hey everybody, this is Adam. We have Christina here as well for another Lakeside chat. And this time we have with us for our guest, we have Tim O'Mara, and he is from Nationwide's Retirement Institute. He has over 20 years of experience in the financial industry, and his role is to discuss kind of confusing topics with people that are really important. And he has expertise in Social Security, long-term care, and Medicare, which we're here to talk about tonight, which overall you kind of think about your healthcare costs in retirement and how that ties into Medicare. So Tim, thank you very much for being with us here, and I'll let you take it away.
Thanks, Adam. Evening, everyone. So like Adam said, I am with Nationwide. I'm probably familiar with Nationwide and our jingle. I have two teenage boys at home. They think it's funny to do the jingle all the time. So we don't have to go over that tonight, but what we will go over is we'll go over healthcare. And ironically, working for a massive insurance company like Nationwide, we do sell a lot of things, but we don't sell anything regarding healthcare at all. So this is not a presentation to then say, hey, here's what you can buy from Nationwide with Medicare. We don't sell anything in the Medicare arena. But what we have run into based on our businesses that we do deal with, there is a lot of misinformation, confusion, and a yearning for knowledge on just what is Medicare, and more importantly, which is in the title, how do we plan for the cost, or can we plan for the cost? Can we look at what it is? So that's what we've done. We've gone out, because we don't sell it, we've partnered with two different companies, a software company and an analytical company, and said, here's what we want to do. And so we're going to walk you through. We're going to talk about Medicare, not going to talk about product, but I will introduce you to a process that you can use that does a personalized Medicare estimate for you. So as we get started, it's not going to be a glitch or anything, but I will turn my camera off. This is just our little disclaimer that says I'm not an attorney. I'm not a tax professional, all that kind of good stuff. But we will talk about, excuse me, we will talk about Medicare tonight. So the first thing we have to do is understanding healthcare, understanding specifically Medicare, and what is ultimately very, very important to understand is enrollment. And we're all familiar with what I call the birthday window. That's called initial enrollment. I'm a storyteller, I'm a visual kind of guy. So I always say it's your birthday window. So that we have a birthday cake. You can enter the month of your birthday, but you can also go earlier, 3 months before, then the month of, or 3 months after, if that's when you initially need to or want to enroll. What is important in this window? I don't care what conditions you have, what prescriptions you're on, what your family history is, smoker, non-smoker, they can't ask you any healthcare questions. So if you're entering at 65 and you have high blood pressure, high cholesterol, the next person is 65, they don't know that you have high blood pressure, high cholesterol. They're not going to charge you more. They're not going to ask you, they can't ask you any healthcare questions inside this window. So it's vitally important. Now, a lot of people are going to say, well, hold on, I'm working past 65. Do I have to sign up for Medicare? Medicare will make it feel like you do, that you're going to get penalized. They are going to charge you more. If you don't sign up at 65, you're never going to get in. That's not true. The second entry point that works just like the birthday window is your retirement window. So let's say someone works till they're 68 years old. At 65, Medicare is going to say, sign up, sign up, sign up. Ignore it. Okay. What they are going to assume is that when you're 68, you go to sign up, they're going to go, gotcha. You should have done this 3 years ago. And you're going to say, no, hold on. I have a letter from my employer that says I retired yesterday, last week, or last month. So that window is called special enrollment period, which kicks in once you sever service from your employer and you lose your group healthcare plan. You can work until you're 75 if you want. So if you have credible coverage and you don't need Medicare, don't worry about the 65 window. Just worry about when you're actually going to stop working. Even if you're covered through, let's say, a spouse. So if I'm going to get to 65, I am going to retire. My wife's younger. We're on her insurance. She's going to keep working. I can ride on her insurance until I'm 68. She gets to 65. I'll have the letter. We're all good to go. That's the only two times you can enter Medicare with what I call a clean slate. Doesn't matter what conditions you have. The problem is, though, As I show you how you put Medicare together, some people try to game the system a little bit. So when I tell you, when you have to make choices for Medicare, at most you have to choose three things. If you don't choose three, then you're only choosing two. And people are like, you're crazy. People get mailed stuff every week. There's buckets. My mailbox is full. I'm getting emails from companies because every insurance company that plays in the Medicare arena knows when we all turn 65. So at 64 in a few months, 64 and a half, you're going to get mail all the time. Right now, we're in open enrollment. If you're close or if you're already on Medicare, you're going to get mail all during open enrollment. My dad just turned 80. He's still getting mail because we just went to open enrollment. How and what do I choose? Well, you have option one and you have option two. Let's look at option one. This is original Medicare. I'm going to go sign up. I'm going to ask Medicare, I want to enroll. They go, okay, we're going to send you your Medicare card. We're going to turn on two parts. A, hospital. It's one card, two parts built into it. Go to the hospital, put down the card. I run up a bill at the hospital. The following week, I follow up with my doctor because I was in the hospital. Same card, put it down. Now part B kicks in. My doctor sends me out to do a test or a screen. That's still under part B. Those bills are then submitted to Medicare. Medicare Part A says, here you go, hospital. Here's what we're giving you back. Here you go, doctor, from Part B. Here's what we're giving you back. The problem is original Medicare never reimburses at 100%. And they'll tell you that up front. So if I choose option one, that's my first choice. Now, the second thing is Medicare says, look, we're not paying for everything, but what we're going to let you do, we have approved vendors and approved plans that you can purchase that back up both A and B, but you have to go somewhere else. You're not buying them through us. You got to go out to a third-party vendor, Humana, Aetna, United. Just an FYI, I have this argument with my dad all the time. AARP is not an insurance company. They are a marketing company. So my dad tells everybody he has AARP as a supplement, but he really has United Healthcare who underwrites it. Blue Cross, all those big companies are approved to sell secondary, supplemental plans, or Medigap plans. They all mean the same thing, but we have to go research, find, and purchase it. So that's my second choice. Then my third and final, I got to go out and I have to find again Part D. What I mean by people saying, maybe I'll game the system a little bit. I'm 65, I'm healthy, haven't been to a doctor in 2 years. I take a leave, haven't been to the hospital in 5. I'll sign up for A and B, and then I'll add my supplement when I need it. When do you think they realize they need it? Probably when they're in the back of an ambulance or someone's in somebody else's car and they're driving them to the hospital and they're like, oh, I didn't add that supplement. And I just showed you the two windows. So they're not in their birthday window anymore and they're not in their retirement window. Now they want to add. Now Medicare companies can ask questions. So only inside those two windows that I showed you are the questions. There is no questions at all. So that's original Medicare. A lot of times what we see people say, Medicare doesn't work. I'm like, why? Well, I keep getting these bills from the hospital and my doctor keeps sending me bills. I'm like, well, why don't you submit them to your supplement? Or they're like, what? Some people just flat out don't have this. They don't add the supplement or they don't know. So we have to package that together to get the product to work the way it's supposed to. Now, that's option one. 3 choices, like I told you, okay? Or you can do option two, which is completely different. Option one contains Part A, Part B, and Part D. There's one letter missing, which is C. C is the umbrella letter that all of the Medicare Advantage plans fall under. This is Medicare, but it's a different form of Medicare. Now, I've been doing this presentation for over 12 years. In the beginning, I didn't talk that much about Medicare, but we all just went through COVID. We all had a bunch of time at home, and the insurance companies that sell the Advantage plans went to town advertising on every station about Medicare Advantage. Who they have as spokespeople are Captain Kirk, Joe Namath, who will pick you up and take you to the doctor visit and bring you hot meals. Jimmy J.J. Walker's doing one, and I think George Foreman does one. I'm not saying it's not Medicare because it is. You have hospital coverage, you have doctor coverage, and you have prescription drug coverage. But it's completely different It is 100% run by an insurance company, meaning the insurance company, same ones I mentioned, Humana, United, Blue Cross, plus a whole bunch of other players, come into your territory. They come into your county and say, okay, who is the major healthcare network in this area? And they put a pricing structure and a reimbursement plan. They do the deal individually with that healthcare system. Example I use, I live in Charlotte, North Carolina. Okay. I have two. I have Atrium and Novant, both major healthcare networks in my area. Now, Humana will go over to Atrium and they will set up an Advantage plan. Humana then goes over to Novant and sets up a separate Advantage plan. So depending on which one you buy, when you drive into downtown Charlotte, hospitals are on opposite corners. You're either going right or you're going left. But you have to stay within the Novant doctors, hospitals, and specialists. Or if you bought Atrium, you have to stay over there. So it's a network-based problem. I'm in Charlotte. I drive 3 hours to Raleigh, North Carolina. I haven't left my state. There are no Novant hospitals and no Atrium hospitals in Raleigh. So if I have to go to the hospital, I am now going to a hospital that is out of network. And as we all know, out of network means out of pocket. The reason they are talking about this is because cost. So dollars to dollars, Medicare Advantage plan is cheaper. But the problem is you can only go where they tell you. And I'll show you another little issue that we get into also and why people may switch. So going back to option one, if you have original Medicare, you can go to any doctor, hospital, or specialist in the country that accepts Medicare, anywhere. So if you plan on traveling, visiting, family, loved ones, grandkids, whatever, like my parents started on original Medicare. They would come down here. If they had to go to the doctor or they go to the hospital, they could go. There was no questions asked, no out of network. They had coverage wherever they moved. My brother lives in Boston, same deal. Okay. So understand, just because they're being really, really heavily marketed, a lot of people say, oh, well, that's Medicare. Joe Namath just told me it's great. I'm going to buy that one. And the next thing you know, they go and they're in an RV for a month and they have to go to the hospital and they ring up a bill. So we got just understand the difference between the two. In the beginning, at least, start with flexibility, start with option one. So as we start to look into these different pieces and parts, let's kind of get into the cost. It's impossible to price out Advantage plans because they literally change county to county. So what I'm going to show you, based on data and what we have, I'm going to show you what original Medicare looks like. Medicare Part A, part of the Medicare card, by hospital coverage. Ironically, we don't have to pay a monthly premium. This is where people say, well, Medicare, part of Medicare is free. Nah, not really. Because if you go back to every paycheck that you ever had, we were taxed, Medicare tax, every single paycheck, which prepaid for Part A. So when we actually go and turn on Medicare, yes, we don't have a monthly premium, but we have is a deductible though. Person walks into the hospital, puts down their card. You're on original Medicare. Yes, I am. Well, do you have a supplement plan? No, I don't. They go, okay, that's fine. We're still going to bring you in, admit you. You're going to have great care. But because you don't have a supplement that you were told to add in the beginning, right, in the whole package part of it, you have a $1,600 deductible from walking in the door. How fast do you think you can rack up $1,600 in the ER? Minutes? Jokingly, people say it was probably cost $500 for the doctor to say hi to you. If and when the doctor finally does get there after 3 tests that were probably $1,000. So people incur this cost and we dig a little deeper like, oh no, I really didn't. I haven't bought my supplement plan yet. It's vital to have all these pieces and parts together. So no premium, but there is a deductible. Medicare Part B. Medicare Part B is very unique. Medicare Part B says, okay, how much do you make if you are filing as an individual? How much do you make if you are filing jointly? I'll figure that out, and then I'm going to tell you what your Part B premium is. So Medicare, everybody on Medicare, so my parents, again, as an example, in 2023 is paying based off your tax return from 2021. They can't go 23 and look at 22 because the taxes aren't even in yet. So they go back to 21 and say, where do you fall on this? This has nothing to do with tax brackets. This is just Medicare's bands for income and then what they call surcharges. So Medicare Part B, we all have an annual deductible, $226. So we pay $226. We're covered for the rest of the year as far as the deductible, but we're paying per month based on what your income is. This is something they look at every single year. So I caution everybody in the beginning, is income going to go from here and then go lower and we're going to try to keep everything down? Absolutely. Is anything happens a couple years later where you inherit something, you have multiple pieces of real estate that you sell, capital gains, you run in, the market's haywire, you go, Christina, Adam, I can't take it, put me in cash, create capital gains, whatever it may be. If you do that in a given year, it's going to catch you 2 years from now. And then what happens, everything that you see in Part B, on the Part B column, 164.90 up to 560, if you're on Medicare and you're on Social Security, that is automatically deducted out of your Social Security check. So we run into people all the time. They're like, wait a minute, I don't understand. Social Security just said I'm getting a cost of living adjustment, and then I just got my first statement or my first check, and it's lower than last year. Well, let's walk back 2 years ago. Was there anything that happened? They're like, oh, had part of a business that they sold. They did take money out of a 401k or an IRA, whatever it may be, that would spike your income. That would catch you for a year, and then it'll roll back down. So just know, because not only does B do this, so there's surcharges for B, there's also surcharges for Part D, which is one of the first things you got to go find. So I got to go find my Part D prescription drug plan. Okay. Now, where we see the pitfalls with Part D, there are multiple Part D plans. And I jokingly used to say, you talk to your golf buddy or you talk to your tennis partner, now I have to throw in pickleball. So now your pickleball team in your pickleball league, you're like, hey, I know you guys are already on Medicare. I'm trying to figure out Part D. I have 3 scripts. I don't know what to do. Well, they'll say, well, I have 3 scripts. I pay $28 a month and they're $5 copays. And you're like, oh, perfect. That's it. Sign me up. Now, if someone's paying $28 a month, which you can, and they have $5 copays, there's a 99.9% chance they're on all generic prescriptions. Right. Your problem when you sign up is you have 2 generics and 1 brand name drug. Well, you just bought the wrong plan. The plan is only going to cover 2. When you go get them filled, to say, yep, that generic is $5, that generic is $5, but that brand name drug is not in your plan, so that's $380. And you're like, what? I thought I had Part D. And they'll tell you, you have a form of Part D, right? So people are like, well, how do I know what I'm going to need 5-10 years down the line? You're making me buy the most expensive one just to cover everything. No. What just started as of October 15th goes through December 7th. If you drive by a CVS or a Target with a pharmacy in it, Rite Aid, Walgreens, you're probably going to see, talk to us about Part D, because you have the ability to change your Part D plan every single year if you need to, but usually you don't have to. But you can change your Part D plan if, for instance, a brand new blockbuster drug comes out, you need to be on it. Happened to my mother-in-law, diagnosed with AFib. Doctor says you need this. She's like, well, that's not in we looked it up. It's not in the plan. Had to bite the bullet for several months, but got her on a new plan that kicked in on January 1st. Now, because you're increasing, because there's new prescriptions on there, is your plan going to go up per month? Yes, it's going to go up $5, $10, $15, $20 a month, but it's not the same as paying $380 per prescription. So you just got to balance it out. The other thing, blockbuster drugs, brand name drugs, have a shelf life and they do go generic. Can you roll back down? Absolutely. If you have a plan and you want to change, I need a better one or a bigger list of scripts, you can change to that. I need to go back down because I'm paying $68, but now all my scripts are generic. You can roll back down that way. Then we get into the cost. The cost is, as far as the bands or brackets, is the same as Part B. So they're going to look at your income. So in 23, we're looking back to 21, 24, they'll look at 22, 25, they'll look at this year. That's how it goes back and forth. But the cost is a little different. Whatever the plan is that you bought, then they do an add-on cost to whatever the plan, because there's multiple plans. Part B is flat out if everybody's paying 164 if they're in the first band, right? Here, you could have a different plan. So is your plan here? Well, if your plan is that, then we add $12 or $31.50 all the way up. So again, both B as in boy and D as in David are what we call means tested. So understand working with your financial professional and your tax professional, you want to understand where you are as far as your tax is and your income and your tax reporting in a given year once you're in retirement. Then we get to the big thing, which is the one where it's very important because this is going to back up both A and B. It's going to help basically cover the cost that they don't cover. And where we are with that is your Medicare supplement insurance, your Medigap insurance, right? Some people call it a policy, which it is. Some people call it a plan. But we have to go out and we have to buy this. But there's multiple. There's 10 on the screen. 2 of them are grayed out. The reason they are grayed out is those 2, C as in Charlie, F as in Frank, were frozen as of 1/1/2020. So now they're frozen. So new folks turning 65, wanting to sign up, those aren't an option. So we put it in a grid like this to see, okay, what's the difference between the different policies or plans? And then really, what is the next best thing if C and F aren't there? My parents are on F, right? So what's the next best thing? Well, if we look at A and B, the problem is they have a bunch of boxes missing. If there's not a number in there, that means we're responsible for the cost. C, not available. D looks pretty good, but it's missing the 2 boxes down here. F, again, not available. Then we get to G. I'll come back to G. K, L, M, and N. Well, they look better than A and B did. M and N look better than K and L because of this 80% down here. But they're not reimbursing us at 100%. So now, again, you're exposed. So if they're covering 50, you got the other 50. Then we go back to G. Right now, if you're looking to purchase a supplemental plan or plan on purchasing it in the next 6, 12, 18 months, always start and ask them about plan G as in George. It is the most comprehensive and will reimburse or cover the most after what A covers from Medicare and what B covers. From that point, now, as we all know in the insurance world, if it covers the most, reimburses the most, it's also going to be the most expensive. But after that, when we start going down, we're going to expose ourselves to out-of-pocket costs, but the actual cost of the plans go down. People ask me all the time, well, what's the best G plan? It sounds like a smart, snarky answer, but a G plan is a G plan is a G plan. If Humana wants to do a G plan, here's the rules and regs, plus other things that you have to follow based on Medicare's rules. If, Humana, United, they all come in, they all have to do the same thing at a minimum in order to qualify for a G. Because if they're not doing it, then they're going to default to another plan, or Medicare is going to basically just kick them out as a vendor. All right. So that's all of our pieces and parts. Then the last thing I want to do before I show you what the healthcare assessment looks like is I want to explain, what happens if I want different coverage. What happens, and I'm not saying anybody on this call, what happens if somebody buys the wrong thing or tries to game the system a little bit? How much flexibility is there in switching? There is some. So I work for an insurance company. I get it. They use the word guarantee on the left-hand side. I say highly likely. This is what we're actually looking for at my parent. I just told you that my dad turned 80 in September. My mom's 76. They live here where I live in Charlotte, in the Charlotte area. Also, my sister lives down here. My brother's out of luck. He lives in Boston, like I mentioned, but he's going to come down here and visit. I don't see my parents traveling that much at all. They're sure not going to get in a car and drive to Boston, probably not going to fly to Boston. So is there a way, because they have original Medicare, are they permitted to switch and look and say, hey, I can save money. I can stay in one of the networks that's here in Charlotte. And can I move from original Medicare with the Medigap plan, which is the top left, and can I go ahead and buy a Medicare Advantage plan? Yeah, you can. During open enrollment, you are permitted to switch. They won't ask you any healthcare questions. You have Medicare with a supplement. You want to go to an Advantage plan, find the Advantage plan you want, sign up, and it'll kick in. Okay, that's one. What happens if I have a Medicare Advantage plan and I don't like it? Well, if you don't like it, then during open enrollment, you can go from one Medicare Advantage to another. Here's a bigger issue. Who runs an Advantage plan? It's 100% run by an insurance company. At any given time in any given year, the insurance company can say, hey, we're not doing that anymore. We're not reimbursing for that test. We're not giving as much for that procedure. We're not doing that. And guess who gets livid about that? The doctors. The doctors will sit there and say, well, as of March 1st, 2024, I am no longer accepting XYZ Advantage plan. And you're sitting there, you're holding the Advantage plan going, wait, hold on. What about me? I have the plan. And the doctor's like, there's other ones I accept. So if you want to switch, you can switch, or you're going to have to go find another doctor. That happens often. So that's the sides that we can switch on. Now let's go, and there are no healthcare or what they call underwriting questions. Now let's move over to where it's not guaranteed, and it is subject to medical underwriting or healthcare questions. I have original Medicare. I understand that A was not as good as G. I bought A to try to save some money. Now I have to go to specialists and do these other things. I need kind of an upgrade in care. This is why I tell everybody, Medicare's dumb, but they're not that stupid. Well, why in the world are you switching from A to G or from L to G? Like, why do you need to switch? When they say no reason, they're like, nah, I think there's a reason. And then they start asking you different healthcare questions and you have to answer. And then from that point on, depending on how you answer them, they may or may not allow you to switch. They don't have to because you already have coverage. And then the last one is on the bottom. This is the big one. This is tough. I really wanted to save money because I like Joe Namath and Jimmy J.J. Walker, and they sold me on this. And so I'm going to go ahead. I did that Advantage plan. Now I need a specialist. Now I need to go somewhere else. I needed, for whatever reason, I need some flexibility. I need better care. I need a procedure done. This also happened to me. My father-in-law, who lives in Florida, and my in-laws are divorced, had to have triple bypass surgery. Now, the doctor said, when you go home, how many steps are you going up? Because, well, I pull in a garage, I go up 2 flights of steps. That's the main living area, but my bedroom's on the third. Doc goes, nope, can't happen. He's like, what do you mean? He's like, I can't have you going up that many steps on a given day or then coming back and forth. And we have home healthcare workers aren't going to let you do it. So he calls me on the phone and says, hey, Tim, I'm coming to visit. I'm like, great. Grandkids will be excited. What are you coming for? I'm interviewing doctors because I'm coming to Charlotte to have triple bypass surgery, and then I'm going to rehab at your house for 30 days. I'm like, oh, great. Had no idea. Now, that's original Medicare. That's not going to happen with Advantage. So someone has Advantage, they need better care. I want to go to original Medicare with Medigap now. You can try. That's the most difficult one to do. So that's in a nutshell what you can do as far as switching. Now what I want to do, and I don't know, Adam or Christina, if there's going to be questions thrown into chat, or you just want me to wait till the end for the questions, I think, right?
We can open it up right now to see if anybody has questions, and then you can move into this part of you afterwards. Let's quickly see. That was a lot of information, very useful and interesting. Does anybody have a question right now that they would like to ask? Oh, Debbie, go ahead.
I do. When you're talking about switching, do you mean mid-year or anytime?
Well, for this,
yeah.
For the guaranteed side, it's only during open enrollment, which is October 15th to December 7th. That's the only time that you can enroll. Now, some vendors will say, if you enroll now, we can admit you in 2 months. Some will say, you enroll now, we're going to wait till the 1st of January. Now, that's on that side is only during open enrollment. The other two, you can try at any time in the year. So if your original Medicare and you want a better Medigap plan, that move on the two on the right-hand side, you can try at any time in a given year. The other two are restricted to during open enrollment.
Okay.
So Tim, are you better off? Like, is there, is the stuff on the right, if you have Medicare Advantage and you want to switch to original Medicare and it's open enrollment, does that better your odds, or are you still kind of in the same boat?
You're still in the same boat because, again, the way I kind of look at it, I'm kind of on the right-hand side, in essence, and I'm not trying to beat up Advantage plans, but I'm kind of stepping down in coverage, in essence. I'm losing flexibility, and I'm gaining money. I'm saving money. So I'm kind of stepping down. The other one is stepping sideways, advantage to advantage. The other one is where I'm actually looks like I'm trying to enhance or I need something else. I need some better coverage or flexibility. That is what opens you up to the questions about the underwriting. So open enrollment, unfortunately, on the right-hand side doesn't make it any better.
And to clarify, some people go on to Advantage plans because they are looking for additional coverage. Say they're not snowbirds and they stay in one area, but they may want a policy that covers dental or eye care or vision in retirement. There are a few Advantage plans I know with clients of ours that they go that route for that reason.
Yeah, because good point, because original Medicare, what we all say is it doesn't cover anything from the neck up. So dental, vision, hearing is not part of original. It is inside the Advantage plans. You do have some coverages for dental, for vision, and then for hearing as well. And each plan, again, each plan varies. So make sure you dig a little. I always tell everybody, ask as many questions as you want before you buy an Advantage plan. There's no pressure. Yeah. Ask as many questions. The questions you always want to ask is, if I have vision, what is covered? If I have vision, what is not covered? Those are real basic, simple. And they say, oh, well, we have a deductible. No, I need you to tell me what the percentage is of the deductible. Because if you tell me it's 50%, if I don't ask, you say, oh, there's just a deductible. The deductible is 50%. My mom's hearing aids were $2,400. Mm-hmm. So if that was their 50%, you're on the hook and they cover 12, you're on the hook for 12, not knowing that you're exposing yourself to those costs. So feel free to ask them as many questions as you need to.
Yeah. And you could also run into where if you have vision, it might only cover an emergency versus an annual visit. So definitely be checking those. But we always tell people locally, at least, we know the Office of the Aging in both Vermont and upstate New York, they will sit down with you and go through all of the plans, both the Medigap and the Advantage plans locally that are offered, and go through the prescriptions as well for people to see which plan might get the best coverage. So we're always pushing the Office of the Aging. Any other questions out there? Go ahead, Debbie.
Once you're on Medicare, do you have to go through open enrollment every year and reselect what you've already picked or change your selections, or can you just coast and stay?
Think of open enrollment as an opportunity to change, but you do not have to. Like, you don't have to re-enlist every year. It's just a function of Medicare that says, okay, there's the ability, or we want some flexibility for them to be able to do a couple different things. So let's set up, and again, this is for people that are already in. Let's set up a time frame where if they want to do a couple changes on a couple different things, whether it's change Advantage plans, change Part D plans, do whatever kind of switch, this is the window you can do it in. If you're good with it, my parents, again, so my dad's been on it for 15 years. I think we switched his Part D twice. We've never touched the supplemental, never retitled never done it, never re-entered anything.
I have a question. Can you hear me?
Hey, Carol.
Yeah, I had it on mute, I guess. I'm confused, really confused. I retired from Pfizer, and I have the United Healthcare Medicare Advantage plan for Pfizer, when I retired. And one of the stipulations that I had to be enrolled in Part B Medicare to get it, and I also have Part A. So where does that put me? And I got it before 2020. So am I Part C?
So what you are in, you are in a retiree group Advantage plan, which is different than an individual person like myself or my parents walking out to get it.
Oh, okay.
So you're almost in a hybrid situation where what they say is, we need you to have A and B. Because let me take it a step back. When you worked at Pfizer was your primary insurance provider. They were paying for your insurance, right? And then when you get to a certain point, what they're going to say is, look, we're not going to leave you out to dry. We're going to step back. We're going to have A and B be first, and then we're going to come behind you, and we're going to work as your supplement and as your Part B in this national group Advantage plan type setting. So it's different than an individual, and it's a pretty nice benefit to have, by the way.
Yeah, I mean, so far, unfortunately, I've had to use it, and it has been pretty good.
But yeah,
Okay, I just was really kind of confused there, but I think you helped out there. So it's more like a gap insurance in a way. Is that one way to think about it?
yeah, it's functioning like a gap insurance, but it also has wrapped in there. I think. Do you have prescription coverage through that as well?
Yeah, well, yes, Part D, yes.
Yeah. Okay. So it's working as your supplement for you is what it's doing.
Okay. All right, thank
And
you.
it probably covers that 20% deductible for Part B, which is really nice.
Yeah, yeah. Like I said, it's worked pretty well for me so far. So I'm not planning to change it, but I was confused as where I really, where I had a plan Part C, and then it came up like Part G and all this, and so it's very confusing.
You have the best.
Okay, all right, thank you.
Yeah,
Peter, you have a question?
yeah, I think they make that confusing on purpose. But anyway, so I'm wondering about the window. If you don't use the birthday window of 6 months before or 6 months after your birthday that you turn 65, and you instead are looking at the retirement date, is it the same kind of window span, 6 months before or after you retire?
Oh yeah, I don't think it's actually 8 months from the day you sever service. So most HR companies, not that there's a law, but everybody. So if you go to HR and say, okay, here's what I'm planning to do. I'm 68. You can be 68 in a few months. I'm going to retire in 2 months. And so can you tell me what my last day of coverage is going to be? Whatever that last day is, you now have an 8-month window to have your choices made and all your pieces and parts put together. So the birthday is a 7-month window. 3 months before, month of, 3 after. And then your retirement is 8 months from the day you sever service. And that piece of paper will get you out of any penalties or any underwriting questions because you had what's called credible coverage through your employer.
Okay, and is there, if you want to, if you're not sure about whether you're gonna still be working after you're 65, does it make sense to just go ahead and start Medicare and have it be, come after your insurance as long as you remain employed?
Well, I tell everybody you're basically paying for something that you're not going to use because your group insurance is going to cover a majority of it. They're basically next to each other. There wouldn't be anything left that Medicare would cover. So functionally what happens is Medicare Part A is pretty much turned on for you because there's no premium. So you probably will get your card in the mail and you'll be like, well, I didn't sign up for this. They're like, well, they just send everybody a Part A, a Medicare card. But to turn on Part B, you're going to be paying extra for something you really don't need.
Okay.
Good to know.
Any other questions out there before Tim moves on to the next part? Great questions, everybody.
I have one more question.
Go ahead.
Both my parents tell me they're in their 80s. Oh, Medicare's great. I don't pay anything. Is that because they enrolled when they were younger, or because someone else takes care of their finances now, or what? I mean, does anyone not pay anything for Medicare?
I'm not going to say that we don't pay anything, but my in-laws and my parents, to give you an idea, we've been through hip replacements, knee replacements, triple bypass, like I mentioned, heart cath, ablation surgery that was in a different state. We went from North Carolina down to South Carolina to get that done. And multiple ambulance calls for my mom when her hip went out. So I will tell you, out of all that stuff, minimal money. Like you can imagine what a triple bypass surgery would cost. I'm going to tell you it was less than $1,000 in any kind of deductible or copays for a major triple bypass surgery. So there are some instances though, because, depending on where they are and what they purchased, it could be all the way down to where they pay nothing. It all depends.
So I just want to clarify, Debbie, do you mean they don't believe that they're paying premiums to have the coverage? Or do you mean that they're not paying anything out of pocket for services?
I'm not really sure. Not sure if they're sure.
Okay. So
My
I
mom
think
was
to,
a, my mom was a teacher, and I think she may be on some kind of group thing, like,
yes,
Well, see now,
retired.
yeah,
Yep.
that's a big group that we talk about. We talk about
Mhm.
retired military, retired government employees, and then teachers, because they have some of the greatest, most generous retiree healthcare plans out there. So
Yep.
she very well may have both mom and dad both may be on the same thing where that was a benefit built in that is still carrying with them today, because we do deal with a lot of retired teachers that have great benefits.
Probably like the retirement plan that the UAW used to have that they're trying to get back.
Correct.
Any other questions? All right, perfect. Go ahead and continue, please, Tim.
Sure. Let me take a few minutes. So that's kind of boiling down, understanding Medicare. Again, great questions. If you have questions after this, come back to us. We'll be happy to help you. But kind of get an idea. So like I mentioned before, not talking about product, but like, what does the cost look like? Because again, go back to my parents. And I think if it's Debbie, your parents, if there is anything they're paying, my parents, my dad started paying 15 years ago, right? And he's still paying now. So it's not figuring out what it's going to cost next year. What we want to look at is what is it going to be next year and then all the way through. Take historical healthcare inflation, look at Medicare. What have Medicare premiums, how have they moved over the last 50 years? Get that data, add a number to that. Can we help folks that are 64 turning 65 or someone over 65 signing up? Absolutely. But if you're a little bit younger and you have a couple years before you get there, or you're not really sure if you're going to retire at 65, so you have some years, we can run and we can do a projection for you as well. So that was the cover. I'm sorry, that's the cover of our healthcare assessment. It'll have your information, and then your financial professional will be on there as well. This is just a recap to give you an idea of what we ask. So this hypothetical situation is a 60-year-old couple saying, okay, we know for sure at 65 we are out, we're retiring, and we're going on Medicare. Okay, so we got a 5-year window. So we're going to say you turn it on at 65. We have to realize, well, how long are we going to have to pay for it? So based on the data underneath where it says current health, remember, I told you Medicare in our birthday window and our retirement window can't ask you any questions. We are not asking questions to get approved or disapproved. We're asking questions that in reality will affect the fact that you will pay more than a person who's completely healthy. So for this example with our healthcare questions, Linda says, nope, I have no issues whatsoever, and I am not a smoker. I'm not dependent on a cane walker or wheelchair, and my family history is not diabetes. So our own personal questions, and then 3 lifestyle family history, nope. He, however, says, yep, I have type 2 diabetes. Based on the software, it does a couple things. One, healthy females, we're going to take out to 90. Healthy males, we take out to around 85. Have a condition, based on the software, not my own opinion, I think it's based on science, will live a little longer. Type 2 diabetes, it's going to knock that life expectancy down to 78. Also, if he is type 2 diabetic, he's going to go to the doctor more. He's probably going to have to go to an endocrinologist, which is a separate bill, separate cost, separate deductible, 1 prescription, maybe 2 additional cost, testing strips, materials, certain things that may not be covered. So on top of premiums, what we factor in is an additional cost column, and I'll walk you through that. So based on these folks, and I'm sorry, and what we do ask you also, what's your income level? Because we have to adjust what Part B would be. So if you know that your income is going to be higher, not your income now, what is your income going to be in retirement? If it's going to be, if you say, well, I know for sure I'm going to be under 97 or I'll be under 194, then use that, regardless of what your income is now. Then we go, okay, let's get some visuals going. So this is the visual. Jim is in green, Linda's in gold, as I mentioned. He's going to cost more in a given year. He's in green. She's going to cost less in gold, but she's going to go out till 90, an extra 12 years. Now we step into the budgeting numbers. So what we do here is we say, okay, let's go out 5 years. Oops. We're going to go out from 2023 and start in 2028. From 2028 to 2032 in that 5-year block, on average, per year, not the total for 5 years, per year, you're going to be just shy of $19,000 a year on average. Less than that in years 1 and 2, right at that number in year 3, but then more expensive in year 4 and 5. In years 6 through 10, the average per year is 25. Then we get years 11 through 15, the averages are 30. And then unfortunately, people get a little excited because they're like, oh, healthcare went down. That's fantastic. No, actually, Jim passed away. So that's where the cost goes. So it's not that they readjusted anything. It's just that now we're talking about one person and not two. So at this point in the presentation, whether it's live or virtual, this is where I did not make any friends whatsoever based on this number that I'm showing you. But then people say, where are you? How are you getting this number? And we said, we get it. We understand. Everybody's skeptic. So where are we getting it from? So what we do is we say, okay, let me give you a spreadsheet. So this is for Jim and this is for Linda. There's no such thing as joint Medicare. So Jim, we're going to line your numbers up on the left. Linda, we're going to put yours on the right. So there's a gold bar that goes down the middle. As you can see, Jim's goes out to 78. Linda's goes out till 90. What we then do, based on their information, okay, we're going out to 2028. We have their income for Part B. We know what Part B is going to be. In this hypothetical, they told us they're going to live in Columbus, Ohio, because that's where Nationwide is based out of. That's what our attorney said to use. So I am going to price the average cost for Part D in Ohio. And if I can drill down, if we have the option to drill down into Columbus, they will drill down into Columbus and say, here's the average Part D plan. And for the supplement, we always price out letter G, so the average G plan. So if you look at Jim's column for Part B, it's the same as Linda's because they're married filing jointly. They have the same cost. They're going to live in the same house, which is in Columbus. So their averages for D in the supplement are going to be the same. But then look at additional costs for Jim. Here's his additional costs. I'll blow this up a little bit. His additional costs are $3,700. Hers are only $1,900 because there's a difference. And the reality is he has to pay for the fact he has a condition. So depending on how we say yes or no, additional costs may be less or maybe more. From that point on, we add historic inflation, run them all the way out until they are 78 for him, and then all the way out to 90 for her. If you do the math on that, whoops, let me go back. If you do the math on that, that is 38 years of premiums that we have to get through, okay? 38. I don't care who you ask. Everybody knows it's going to be expensive. One thing that we take into account, we want to go back in and say, okay, let's look at the total. So we take everybody's total, run it all the way over to the right. You have two green headers. One says, here's how much it costs. 16,000, 17,000, 18, 20, 21, and it just rolls up. But then there's another column right next to it. And people are like, well, I like that number a lot better because it's a lot less, right? What we're doing is saying, if you're on Medicare, remember, on Medicare, on Social Security, the Part B premium comes out of your Social Security check. You're not taking it out of your cash in your account, out of your bank, out of your savings. It's being covered by your Social Security check. So if that's the fact, we take 26 from Linda, 26 from Jim, and pull it out. So we're taking $5,200 plus out. Now what we need to do for a budget is we need to budget for 11, 12, 12, 13, 14. So we can understand the difference between the two numbers. Then we just run it all the way down. So talking to this couple, having a 5-year window, what the budget is, putting into whatever software plan you're with your advisor you're working on, we're going to average probably $17,000 in the budget. What can we do between now and then to make sure that we can pay $17,000? Okay. That's our report that we run for you. This is the way the report can be run. Again, this is all going to funnel through Adam and Christina. So this is our questionnaire. It takes less than 4 minutes to fill out. The information always, and let me highlight this, the information always at the top is from the financial professional. That is the only contact information we are allowed to ask for, and it's the only person that we contact. We will not contact you because, as you can see, when we ask for your information, we ask for first name, last name, gender, current age, retirement age, state, city, and county. And there's multiple, so you can put multiple if you want to. Multiple places you can put. But here's what we're not asking you for. I don't want your home address, your home phone, your email, cell phone, Twitter, or now X, Instagram. I don't want or need any of it. I will run everything through the advisor. If there's a question or a need, then we get back on the phone together, but we're never going to contact you because we don't have your contact information. And after that, you don't have to even write anymore. All you got to do is check a box. Same questions we asked Jim and Linda about their healthcare. Do you have this condition or that condition? Yes or no. Go through, check those. There's 11 questions. Say yes or no to that, just checking a box. Tell me what your income is because it's important, because not only B, but also D, boy, B as in boy, D as in David, they're going to have surcharges. Just tell us what you think the income is. If you're not sure, just check the first one and we'll just go with the first band. It's not, none of this is set in stone. And you can come back multiple times and rerun it if you want. Ooh, let me hold on 1 second. I think my dog just got out. Sorry about that. So tell us what the income is. We'll do that. And then the last one would be, tell us what report you want. So the report is, Jim and Linda, we have A, B, D, supplement, and that out-of-pocket column that I showed you. Some people say, I'm just kind of getting my feet wet. You know, that's a lot of information. Can you take the out-of-pocket cost out and let me look at just premiums? You can, if you want. I don't really agree with it, but you can. And then ironically, we just talked about what Debbie gave us an example of, is that you can do, in Debbie's parent situation, is they don't need the supplement. And also the other gentleman's situation, he doesn't need a supplement. He has a great benefit through Pfizer. So all you really need to do is look at A and B and D. That would be option 3. And that's it. That's all we need. And we can run that report for you. So with that, guys, I will turn it back over to you. I don't know if we're looking at any more questions that came in, or open it back up for everybody if they want to.
Yeah, I should have explained, we can't do chat function for LPL, so everything has to be live. Does anybody have any questions out there?
I have one.
Go ahead, Debbie.
So in the supplemental part, there were all those different letters. And there was the one plan that was better than most, the G, I think it was.
Yes.
Yeah. So I will be 65 in 18 months. Is that still going to be there then, or can they just black out, gray out whatever they want? The government,
they can make changes whenever they want, but I will tell you again, for 14 years that I've been here, the only change that they've made to supplementals is freezing. So my parents were already in on their F, so they didn't lose it. It's just new people. So as of right now, based off what is available, I don't hear and I don't see of them doing any changes in the foreseeable future. Not that they can't, but I don't see them doing it because of what they did in 2020.
I'd agree.
Well, just out of curiosity, why did they freeze them? C and F.
They have
good question, Carol.
They have done it a long time ago in the past. What it comes down to was the Part B. A lot of people are saying, well, the Part B premium's covered and it shouldn't be covered. We should pay something for a deductible, which is why F is. But then they froze C too, and C doesn't, C also covers your deductible, but then you have Part B excess charges. there wasn't a lot of rhyme or reason other than what they really said was, we're going to be responsible for paying $226 for our Part B deductible. It's weird.
Down to the last minute here. Anybody last minute questions? All right. Well, Tim, we want to really thank you for your time and explaining all of this very confusing and overwhelming information to us. You did it in a great fashion. Adam, you have anything you want to add?
Nothing new, but ditto on what Christina said. Thanks very much, Tim. Thanks for all the great questions, everybody. Thanks for joining us and talking about Medicare, even though it's not the most exciting thing. It's definitely confusing for most, so it's always useful to talk about.
Yep, learn something new every time. All right, great to see everybody. I hope you all have a wonderful evening, and thanks for joining.